Hello, and welcome to this session on pregnancy after loss. So, in honor of Baby Loss Awareness Week, we're going to be speaking about loss from IVF to stillbirth to loss at any point of a pregnancy. And I'm very lucky to be joined by two amazing women today who are going to share how they support others and their experience within this area. So, I won't talk about myself for too long, but first of all, let me introduce you to Emma. Emma, could you start with sharing a little bit about your personal experience with pregnancy after loss and also a little bit about TFMR Mamas, which is a support network that you have created yourself, and how you came to do that and what impact that's had within this area?
Yeah, so thank you for having me. My name's Emma Bell, and as with most people in this area, when they start up an organisation, it comes often from a personal experience, which has been my story also. So after a difficult road to getting pregnant with Willow, who we lost through TFMR baby loss, and we'd gone through 5 rounds of fertility treatment, had an early loss on the first round, 3 failed rounds, and then on the fifth round, got pregnant, got to the 12-week scan, thought that we were going to be, you know, like everyone says, don't tell anyone for 12 weeks. I was talking about it anyway, but that's what people say, right? So you think that you get to that point and you're kind of off into a safer zone, safe
Mm.
zone. But then very quickly after that, our NT scan and following NIPT scan, we had bad news that our baby was sick. They had a cystic hygroma. There was sort of clubbed hands and foot presentation in utero, and then the NIPT came back high risk Edwards syndrome, and I was told that our baby would likely, because of the fluid over the abdomen and around the head, that the baby's heart would likely stop before I reached term. They thought maybe by 28 weeks or something I would lose the baby in utero. And if by chance I did make it to full term, then the baby would likely only live hours or days. Um, so we were kind of left with a choice of, I felt, when do we let our baby die was really where we ended up at. And although it's not something you ever imagine, you'll be Googling how late can I end my pregnancy in a pregnancy that's come off the back of infertility for however long, that's where we were at. So we made the difficult decision to end our pregnancy at the beginning of my second trimester. And I flew back to London actually, because I wasn't aware at the time that there was care options out here for me, which obviously now I'm part of this amazing group of people. I'm aware there are more options out there for people. And we said goodbye. And then went on to have more rounds of fertility treatment that didn't work, discovered male factor infertility, lots of other things. I mean, there's many other panels going on that will go delve into infertility. And we finally got pregnant with our now living daughter and had a very stressful survival mode pregnancy after
Yeah,
loss. Um, and off the back of the loss with Willow, I set up TFMR Mamas, and that was because I wasn't waiting till 12 weeks to share my pregnancy. I was sharing everything real time, infertility wise, online. And out of that came a need for peer support for people going through TFMR baby loss that was real, that wasn't
yeah.
afraid to speak the ugly part of it all. And TFMR Mamas was created from that.
Lovely. Thank you for sharing that with us. And you touched on a couple of points that I'd like to come back to. But definitely that kind of fear and that going into a pregnancy that is healthy, everything is okay, but the not knowing that
Mm.
that's going to be the outcome, and kind of and navigating that. So we'll talk about that in a moment. Nikki is a midwife who specializes in bereavement care. So I'll let Nikki kind of introduce herself, and if you could tell us, Nikki, a little bit more about what you do and how you support families also going through a similar thing.
Well, thank you for having me, first of all.
Well, thank you for joining.
Always a pleasure to be involved with Love Through Loss and every associated organisation. So, yep, I'm Nikki. I am a UK trained midwife. I've been in the UAE for the last 9 years. And yeah, I specialise in bereavement care, bereavement support. When I was doing my training, I was very lucky to be involved with some very great bereavement teams, which is not always the case for midwives. And it's something that just felt right for me to be a part of. I understand that that is not the case for every midwife, absolutely fine. But for me, it was an area that you can make such a huge difference. And where I actually, when I qualified, I worked in central Manchester, and that there was a Tommy's team in that hospital. So I got to see so much and got to learn so much from the doctors in that team and the midwives who had been in that role for quite a long time. So I was lucky in that way with my training. And it just kind of developed from there, really. When I moved to the UAE, to Dubai, I was very shocked at the lack of awareness in just OB/GYN teams and other branches of healthcare in general. I did notice a lack of education on our part as professionals. It wasn't there. And a lack of kind of, I would say, empathy and compassion, because if you're not taught about it, how can you then, be compassionate and like empathetic towards it? So it was one of those things where I was like seeing people leave the hospital thinking we could have done so much more for them. And I then went on to do my master's. One of the modules I chose to do was perinatal bereavement. And again, that just let me explore things in more detail. And my dissertation was actually on sort of how can we improve training of staff, so from our point of view, we can provide the best possible care before signposting on to other relevant professionals. And I've been involved in creation and training and dissemination in one of the hospitals I used to work at, just giving real life exposure, but also kind of the hands-on training behind some of the things that we need to do as midwives when we come across a loss of any kind. And one of the things I did notice a lot was, for example, here, a lot of the time, the terminology we use is really, really poor. And thinking something's only a loss at a certain gestation or for a certain reason, because that's what a medical textbook says. So kind of unpicking all of that and trying to kind of lay new foundations. And that's something I still do for anyone who asks. I'm not clinical anymore. I don't work in any hospitals anymore. But if I get a call from a midwife that I know who's like, we just don't have the capacity to deal with this, I know I can go in, I know the process backwards and forwards, and I can help kind of the transition through that postnatal window until parents leave the hospital and after, really. And most of my clients that I do sort of midwifery kind of antenatal sessions for, and sometimes birth support, are very often pregnancies after loss. So you need an extra layer of support there, without a doubt.
Yeah, absolutely. And I realised I didn't say anything about myself, which kind of links into what Nikki's saying. But I'm also a UK trained midwife, and I've been in the UAE for 13 years. I was in the UK for 4 years before I came out here, and we had a really lovely bereavement team. Similar thing, not as big. It was I worked for quite a small sort of middle of the road hospital, definitely not as big as Manchester, but the bereavement care was really thoughtful, really lovely. They'd really push for parents to keepsakes and spend as much time with their babies as they felt comfortable with. And they offered counselling and they offered follow-up support, and there was all these amazing things in place. And I was equally very shocked when I came here. And also that kind of expectation of culturally as well. And I think culture plays a big factor in this part of the world. And we have to also expect it's not just healthcare professionals, but it can be families and it can be people around those. And I see that a lot with the women that I support. Again, generally I find that if you're looking after supporting somebody through a pregnancy, they've generally had, lots of people have had a road to get to get to where they are. And that's what I wanted to talk to you both about. And Emma, you, like I say, you touched on this, but the fear of pregnancy after a loss, and the fear of, and I see that as well with infertility, the fear of this is too good to be true. I shouldn't enjoy it. I shouldn't relax. The telling people again is a very individual, personal, cultural. I've looked after clients that have had a loss at maybe 15 weeks, and they will not tell anybody until they are at least 15 weeks, because that is the goal. The goal is I need to get to here and then I'm going to be okay. And then they get to 15 weeks and actually there's still a lot that and then it's like, okay, well, actually, I'm not going to tell people now because I'm going to wait for my 20-week scan. And then, I'm going to wait till I feel movements. And now, now there needs to be a movement pattern. Or now I need to get to this next follow-up. So there's always this moving goalpost and this fear around loss. And that's something that people I support report back to me a lot. How did you find that personally, Emma? And also, Nikki, what's your kind of experience with the families you support?
For me personally, I was terrified my entire pregnancy, and I didn't believe that I would take home. Well, I'm going to say this and then I'll say something else after. I didn't believe I would take home a living baby until she was in my arms alive. And what I would say is that even at that point, my fear transferred into her newborn existence with hypervigilant checking, even this irrational thought process, this you're so shell-shocked that the problem is you can't believe that it might happen, because all the evidence, especially when you've gone through infertility and loss, is so multi-layered. All the evidence has ever shown you is it's going to end in loss. That's all the evidence you've got in your piggy bank. That's it.
Yeah.
And then it's like hurdles. It's like a hurdling competition is pregnancy after loss, like the next hurdle, the next hurdle, the next hurdle. You get to the point where you give birth, however that looks for everyone, and you're already exhausted. I found that I entered newborn life, that newborn chapter, absolutely in the negative on the energy. Now, I'm not saying that other pregnant people also don't feel that, but I was holding my breath for my entire pregnancy. And when my now living daughter was born, she was actually born not breathing for a short period of time and got taken to the resus table, and my husband had her. My husband held her. Once they'd done what they were doing, my husband then held her until she was an hour old while I was having stitching up done and whatever was going on. And some people might think that that was a really detrimental thing. And in some ways, there are parts of me that are sad about that. I have to be totally honest. There was an enormous part of me that was utterly relieved that somebody else was keeping her alive for that hour. I thought, it's not all on me now.
Yeah.
You do it for a second. I need to just breathe. Like, there was a huge, overwhelming relief that it wasn't all on me to keep my baby alive. And for a second, somebody else took the reins. I can't even explain the relief. Now, obviously, there's also a little part of me that would love to have had the idealistic, like, golden hour, all of that. And you know, after they did what they did with her, she was with her dad. She was in eyesight. I didn't see her face. I didn't hold her. I didn't touch her for an hour. And all I kept saying is, okay, she's with her dad. And there was a massive part of me going, thank goodness someone else can do this for a minute, because what I was 41 weeks when I gave birth. So it wasn't even like, you know, a short it felt
Yeah,
like
exactly.
41 years, and you
Yeah,
know, it was just long.
yeah,
So there was a huge part of me that was so relieved for that hour. It's not all
yeah,
on me. And when I shared that on my social media, I had a lot of other people who've gone through pregnancy after loss all said the same thing, that their fear transferred onto their newborn baby. It came out in other ways and it went on for a really long time. And in the moments that somebody else picked up the baby, someone else was involved in like a critical moment, there was that feeling of, thank God it's not all on me,
yeah.
because that's how it feels when you're carrying the baby. So
And it has been all on you. And I really love that you've shared that, because that's a really honest, raw, real feeling of what you went
yeah,
through. And because it was all on you. You know,
yeah,
it's the baby is in your body and
yeah,
you are experiencing this and you've experienced a loss. And although we know there is no absolutely 1000%, there's no blame on you for any losses, you're still carrying that. This is my job to keep this
this
little
burden
person
of
alive.
responsibility,
It's, yes,
absolutely, just
and
by
it's
being the vessel.
huge. Yeah, it's huge. Yeah. So I completely understand that perspective.
And you just
Um,
don't believe it. Like, I remember having conversations with Lala. I had to have a contingency plan for every purchase that I bought. I couldn't justify buying anything unless I could justify it in life or death of my baby. So
yeah,
if I bought clothes, it's fine. I can put my dead baby in the clothes. I can put my living baby in the clothes. So whatever happens, there's a plan for this object that is terrifying to me. You know, all these things. And I got stuck on the buggy was okay, because Lala was like, we can bring the buggy to the hospital, we can put the baby in the buggy, we can walk around with the buggy, we can use it whether we have life or death. Cool. Like, not everyone might feel like this, but this was my truth, right? This is where I was at.
yeah,
I had to have a contingency plan for everything, because otherwise it felt too terrifying to bring that object into my house because of the meaning I might attribute to it should it not work out. So I had to have a plan. If it doesn't work out, what am I going to do with this thing? Okay, I can do both. Okay, cool, I can accept it for now. The thing I struggled with the most was the car seat. And we arrived at, don't worry, Lala, I'll go to the desert and burn it. Like, it's cool. We had a plan for everything. It was just, but it was the
yeah,
most terrifying experience of this journey so far for me. Yeah. And out here, I think bereavement support needs to be involved in that pregnancy after loss, because
yeah,
there's this mentality that now you've got this healthy, normal, what seems to be going to full-term pregnancy, so you get treated just like a normal pregnant person without all of this stuff, but all of
yeah,
that comes into that pregnancy. It doesn't matter how hard you try not to, because all it takes is someone to say, is this your first? How many kids have you got? Da, da, da. And it's just like, and it's just every appointment's just an absolute heartbreaking moment where you've got to advocate for yourself, where you're constantly having to put the energy into advocating for all of your children, and you're just tired. Like, you're so tired. I can't explain how tired you feel, with emotionally, as well as the pregnancy hormones, the physical, the swollen feet, all of that stuff,
yeah,
right, that you go through anyway. And even like when I was giving birth, you know, like, my preferences for being monitored, I wanted to be stood up, and then there was this request for me to be lying down, and I said, no, it's been agreed I can stand up. And because I wouldn't lie down on my back, the midwife came in, and her exact words to me, are you not concerned about the welfare of your child? And I was just like, this is a pregnancy after loss. I am completely concerned about the welfare of my child, and now I need you to
me and Nikki are slowly like cringing
I
inside of
need you to
like,
leave.
oh
Like, if
gosh,
a bereavement
like,
midwife had been involved in
yeah,
my care, they would
yeah,
know that that would be it's a completely inappropriate thing to say
yes,
anyway. Even more so,
completely inappropriate. But and even
regardless
not
for her.
even a bereavement midwife, but somebody
Regardless.
that's had training
Yes.
and
Yeah.
somebody that's empathetic.
Yeah.
Like,
You know, like, you know, so there's just like so much, but that's even more loaded on someone that has already gone through a loss. Like, that's like a double whammy, you know? So there's a lot that definitely could have been easier. And I think for anyone going through a pregnancy after loss, I don't even know how it works, but it would be fantastic if there could be reassurance scans, little like throughout, just because the stress levels that you have when your head starts spinning. I think I even messaged you, Nikki, at one point. I was like, you know, like everything's probably fine, but I'm spiraling into this place, you know, where a quick reassurance situation could just be what I need for the moment, you know, rather than everything's fine, don't worry about it, you know, that kind of, it's not helpful, you know, it's really tough.
Yeah.
And one day
Yeah.
feels like a month, you know, in a pregnancy after loss. It's just, yeah, it's definitely really tough, really hard.
And Nikki, kind of your take on this, from what you've seen, do you find that it's something that a lot of people report to you, feeling similarly to how Emma has when they're navigating a pregnancy after loss? And what kind of support have you seen in place, and would you recommend, you know, somebody's going through pregnancy after loss, they're watching this now, what support would you recommend, or how would you recommend they navigate this pregnancy?
I mean, Emma's hit the nail on the head. I think that's like everything you said, I could think of at least one couple or one woman who had been through or voiced something similar to me. And the thing is, the mentality around pregnancy after loss is, oh, well, you're pregnant again. Yay. And they don't see that invisible load that is on your shoulders that is it's never gonna go. You're now just having to carry that and carry a baby that just adds to that load. It could be guilt, it could be fear, it could be like shame. A lot of women report shame in feeling like they can't get excited about their pregnancy, or they're not telling people. They feel bad for withholding it from their closest family and friends. And every day does feel like a year. And I think the lack of kind of antenatal support in general in a pregnancy is abysmal here. But when we talk about pregnancy after loss, most of the clients that I have that have experienced any kind of loss before come to me because I will go and see them weekly. And, you know, can I go to an appointment with them? Because sometimes they're so scared turning up to an appointment that they retain nothing but there's a heartbeat. So, you know, sometimes I will go to an appointment with them. I will take down notes. I'll send it to them. We'll chat about it the next week. But having bi-weekly or towards the end weekly check-ins, also being an advocate for reassurance scans.
Yeah.
I also don't, I think that use of reassurance scans should be absolutely used in any pregnancy after loss, because actually we know the evidence on stress and pregnancy, and that the links that we can cause there, like thinking about our living children and how that manifests at a later age. So there's all these things that it's not just a one-off, it's something that we're implementing that will benefit mum in the pregnancy, dad in the pregnancy, and baby long term. So it's something that we don't need to brush off as like, oh, she's anxious, she had a loss, you know, she's back again. It's why don't we set up a system?
Yes.
And having midwives in a clinic, for example, that can listen to your baby's heartbeat. So you're not necessarily having a scan every week, but you know there is a place that you can go, or a midwife you can go and see, or to call to your house, and you can just hear that heartbeat and exhale. And something like that is absolutely what we need. There is nowhere that does that routinely at the moment. Yes, they might offer sort of clinic visits or home visits, but there's nothing routine specifically for this demographic of women and families, which is 100% what's missing. And it is kind of from an education aspect, like thinking about what people report back to me, again, you know, exactly what Emma said. There's so many moving parts to the fear and the anxiety that you have around your pregnancy after loss. It's like, I love that dress and I know I'm having a girl and it's in the sale, but if I buy that, something will go wrong and it'll break my heart all over again. So it's about kind of educating all the staff as well, and even family and friends, you know, they want to be lovely and caring and it's coming from the best place, but they buy you, you know, a breast pump and automatically you go, I wonder what one I would have had with my other baby. Will I ever get to use this one? So it's kind of about creating a bubble around yourself.
Yeah.
Not meaning like isolation, but isolate yourself from the people and the situations that don't serve you, because we want to just help you carry as much as possible whilst you go through the pregnancy. We don't need anyone to add on, as well-meaning as it may be, but we need to kind of create those boundaries. So someone like a bereavement doula, and I mean, my first example is always Lola, because she's like human sunshine anyway, but she has such a depth of knowledge. She knows more about bereavement than I'd say 90% of midwives, no, probably 99% of midwives in this country, right?
Yeah.
They don't have to be a professional, but they really do have to have experience of how to support through bereavement as well. And I find there's a lot of people that are available in the UAE, but as well, going through a bereavement yourself is not always the best way to support others, because we all grieve and process differently.
Definitely, yes.
And you want to find someone ideally, or like there's independent midwives. I'd be very selective with who you choose, because being a midwife, as we can say, does not mean we are good at everything or we understand it or we can support you well. So even like, I would say reach out to kind of anyone, you know, associated with Love Through Loss, because that will, or any other sort of organizations similar wherever you are in the world, but they can direct you to the best people. We all know each other. We're all here on a call. Like we all know who is passionate and really cares about this kind of part of maternity care. And the one thing that I do the most with all my clients is just talking about like these hurdles and things, is that we get through the day. And it will never, your brain will never stop thinking about the next hurdle, ever. Even like Emma says, when your baby is outside of your body and you can kind of go, the hurdle's just moved outside of your body. But thinking about, I'm going to get through today. How did I feel today? And I like to ask my clients to either kind of make notes, write it down, record a voice note to me, play it to me when I'm meeting you, or send it to me. Doesn't always need a reply, but you know, like some like check-in points. And obviously perinatal bereavement, mental health support, it's become much bigger in the region in the last 4 years. I'd say I've really seen a spike, but accessing that as soon as you can, if it is within your means, and I know it's not within everyone's means, but there are other kind of more economically friendly options. They might just not be local to where you are. And I'm very lucky. I work with some lovely people that I'm sure we all know. And I actually say, you know, if there's something you're particularly struggling with and I'm your midwife supporting you through this journey, would you be happy with maybe having a Zoom call between me and your therapist, or just to put plans in place that she can suggest, I can suggest how we can meet that, what we can ask the hospital for, what we can ask your doctor for, like, you know, no confidential information, but after your talks, like, and I've had a lot of these kind of meetings together and it's been invaluable. So yeah, that's my take.
No, I think I love everything you've said. I'm like, yes, do this, yes, how can we do it? But like you say, in the advocacy and being there, and yes, having a professional, if there is a professional available and you have the means to, but also surrounding yourself with the people that don't add additional pressure, in the sense of, and you know, using the right language. and I'd love to do sessions with families to it teach them the basics of never say at least, you know, never say, oh, it was only just, or, you know, don't dismiss somebody else's pain. Don't diminish that with them. And like you say, and I'm sure you can speak to this, Emma, but when you went to the appointments, you had Gareth with you, and maybe Lala with you, or somebody with you, but you were just listening for that heartbeat and maybe didn't take in all the other information. But having somebody that understands or is empathetic and is close to you and you trust to go with you to appointments is a huge weight off your shoulders, I would imagine, when you're kind of navigating that. And Emma, I kind of wanted to come back to you with TFMR mums. How did you find supporting other mums, because it's something that you do, and then going into a pregnancy? Did it help you emotionally? Did you find it beneficial? And how did that role of support play a part within your pregnancy, your healthy pregnancy?
Yeah, I mean, I actually held, because before TF Mamas, I'd done peer support groups with women going through sexual trauma recovery, and so I'd kind of had experience on how to hold space for other people without making it about my personal story, and how to separate myself from other people in terms of not taking on everyone else's emotions as my own, but just being able to be a container for somebody else's. So with that said, I was able to start, because I started the support groups, and then I had, naturally, people were trying again, and they were getting pregnant, and of course that space was no longer suitable for them, because they became very activating for those that were fresh, just having had their loss. So I then had the pregnancy after TFMR support groups, whilst I was going through infertility with no living children myself. I still held those spaces for other people. Now, that, I would say, is only down to my previous experience beforehand of holding space for other people whose experience isn't shared with my own, and being able to be okay with that, and having supervision, if you like, through having my own dedicated therapy sessions where I could offload anything that might have activated me in that session, or whatever, you know, like, you have to be responsible if you're going to be holding spaces for other people, and know your limits, and be truthful to that, and be able to do that, and not make it about your journey, unless you're being interviewed about your journey, like I am today, for example. So that's how I was able to do it. It taught me a lot in terms of, it just broadened my experience to supporting people with different stories, people who then came to the very difficult decision to no longer continue to try again. So we then had a separate space for them, because anybody that was TTC was very activating for them. People who then went through that successful pregnancy to term with a healthy baby, and then parenting after TFMR, because what I was finding was, I suppose my biggest learning, which kind of gave me a heads up that it might happen to me, was that the people that had gone through that pregnancy after TFMR then went into the newborn stage, and at about 3 or 4 weeks old, I would, more or less with everybody, get a message saying, Emma, I'm really struggling. I can't sleep. I'm worried the baby's going to die in their sleep. I'm worried someone's going to just come and tell me that the baby's not mine and take it taken away. All of this stuff. And I suddenly realized, oh my goodness, the support doesn't stop here. A healthy baby doesn't, you know, not that I thought that anyway, but it just reconfirmed that, like, actually the support I offered needed to continue. So that was probably my biggest learning in my support space, was that. And that's why the parenting after TFMR groups then began. So as they hopefully had their healthy babies, they all then went over into the next group and linked them all together there, you know. And actually that was probably one of the most valuable spaces, because it was the most unexpected space for people. They knew they would need support after loss. They knew they'd need it in pregnancy. They knew they would need it if they didn't try again. But 80 to 85% of people didn't understand the enormity of the support that would be needed in parenting a newborn after that journey. And that's probably the biggest learning I had from all of that. And it also played out in my own personal experience too.
Yeah, no, that's also a really valid point of very often when people have experienced a loss or they've experienced difficulties, realizing that there's going to be a live baby at the end of this, it seems to be a very big shock to the system, and not believing that that's real, and not believing that something bad then isn't going to happen, because the stories that you might have heard or the experiences of other people can sometimes
not only that, just
stay
your
with
own
us,
experience,
and your
like
own
your own
experience.
of
Yeah,
never having had anything other than loss.
yeah,
And it's
yeah,
disproving that takes time to
yes.
integrate into your reality. It takes a really long time.
And that kind of, I say, so like the 3 to 6 week marker is when you had a massive hormonal shift, you are exhausted, you are sleep deprived, and then you have all of this other stuff on top. So it's a really difficult position to be in, but you created those amazing spaces so these women and families can come and say, I'm struggling, and it's the people that don't have that support that it's a worry for, because how do they reach out, what do they do? And this is why Love Through Loss is so amazing, because just like Nikki was saying, everybody in this space, we can point you in the right direction. We can say, okay, I might not be the right person for you, but go and speak to this person and they are perfect and they can hold space for you and they will help you to navigate whatever challenge it is. But I definitely do think there's a big element of postnatal, so pregnancy after loss and postnatal after loss, that people don't understand or don't acknowledge or recognize, because they go, oh, okay, you had a loss, but now you've had a healthy pregnancy and a healthy baby, so you're fine now, like you're over it, and
It's not.
that's not
Do
the
you know
reality of it.
the other massive thing that I noticed, and I'll share it because I wonder if it will resonate with people, is that because I hosted those pregnancy after loss groups before I was in that space myself, I got to bear witness to everybody going through that journey. And then obviously the parenting after loss groups popped up as a result of them having their babies at home alive. And what I noticed, there was this pattern that, say, for example, someone had lost a girl, their girl had died in utero, and they decided not to find out the sex of the baby during their pregnancy after loss. And they found out at birth. Around the 3 to 6 week mark, there was a huge fallout. And this isn't just one person, this was over and over again, of this overwhelming grief, because despite what anybody kind of says, I think there is some expectation in a pregnancy after loss, and it can be for either reason. I really want to have a girl. I really want to have a healthy baby is always the thing. But there'll be something else going on for someone. They really want to have a girl because their expectation was to parent a living girl. Or I really don't want to have a girl because if I have another girl, that means I'll lose the girl. So I want the opposite. So what then I witnessed happening in other people was that if they didn't find out the sex of the baby during pregnancy and found out after birth, the birth and everything was so overwhelming, the first 3 to 6 weeks of newborn life was so overwhelming that there wasn't time to process the sex of the baby at the same time. So then there was like almost like an overspill that came afterwards that was attached to the loss in this huge, like, overwhelming way. And then what I also witnessed was those that did find out the sex during their pregnancy would still have that, but they'd have it during their pregnancy after loss. So they didn't come like a tidal wave, birth, newborn life,
With everything.
yeah, they had that whilst they were in the pregnancy after loss, not in the newborn phase. And honestly, I cannot tell you how many times I've witnessed that play out now. literally over and
100%,
over and
yeah.
over again. And it's just been such a interesting journey to watch people go through. And it's almost, I can almost see it coming, you know, because obviously it's happened literally on a recurrent basis like that. And probably I'd say 90% of cases, it's just been a very interesting thing for me to witness that I would just think about.
Yeah, and Nikki, with your sort of bereavement work, you must see with the postnatal side. So the beauty of supporting people antenatally is that you get to know them, you see them postnatally as well, is the hope. And what's your kind of experience with that? And I think that's a really interesting point, Emma, that you wouldn't think of, and you wouldn't think that the gender of your baby is, but you're saying this, and there's so many people I can think of that have experienced a loss, and I'm like, yeah, they did that. That's the thing that has happened. Have you seen that as well, Nikki?
I've definitely seen it. I've seen most people that I've supported and that I know, they have found out the gender. And like you say, Emma, whatever way they want it to come out, they're able to process that, whether it is the way they kind of envisioned in their head, but they're able to process that during the pregnancy. I've definitely seen the tidal wave. And I see quite often, they're just like mini tidal waves. And it's really, really prevalent in the postnatal period because, you know, going home, doing the first bath, and, you know, most of the time I'm present for the first bath, just that anxiety, like, what if we drop the baby? What if the baby drowns? Like you have all that in your head. You've got that noise. Both parents have. So a lot of the time I'm there just, you know, little helping hands. And, you know, mum and dad will just break down because they never got to do that with their baby prior to this, them having a living baby at home. And it can be tiny things like that that can trigger these mini tidal waves. And it can be, you know, something as simple as I've seen putting on some nursery rhymes to dancing with baby, and just the floodgates just opened. And there's so many pockets to our grief, and everyone has different things in different pockets, but we don't know what the key is that will open them. But we know, like you said, the hormonal shift, the sleep deprivation. Nobody eats well in the postpartum first, I'd say a good 3 months before people really start, you know, realizing that we can't pour from an empty cup. Because, and I think it's exacerbated with parents who've suffered a loss before, because the hypervigilance really is there. So I definitely have seen that. I've also seen a lot of hypervigilance around, like what you said, Emma, like, what if the baby stops breathing? What if, you know, what if the baby gets too hot and the baby dies? And these are, you know, what if I drop the baby? Just questions that somebody else might not think to even voice. But when you've been through a loss, already there is this, like you said before, Hazel, there's no guilt to go to anybody ever in this situation, but there is always inherently that sliver of guilt that you will carry, and you can do all your therapy and everything, but it's so deeply ingrained, and we feel it so deeply that, you know, you think, well, I was supposed to have a living baby last time, and this happened and this happened, and why couldn't I prevent that? So it makes sense that they would ask questions like, what if I drop my baby on its head? Or, you know, what if this does happen? And there's a lot of things I like strategies I like to use for that. What I find works most in my, you know, with my client load that I've seen be successful is, first of all, during pregnancy, if they are willing to do it, I do offer newborn CPR. Having something that is an actionable skill often really, really helps new parents be really prepared. I give them a little thing to put on, a magnet to put on the fridge, because when baby's inside you, we can't, very rarely can we really do anything to stop what's happening, whatever that may be. But I always explain to them, like, baby's tangible, baby's there. I'm going to give you these tools now, because you can action these things. So depending on the person, because some people work that way, some people don't, it's fine. But spending time with them throughout the whole pregnancy allows me to figure out who is who and what will work for what person. But also just doing things like, okay, great, I see you've bought the crib. Would you like me to go into the room? Because they might not be happy going in there. And do you want me to just have a look at it? Let's make everything safe for sleeping. Let's have a look at setting up, you know, your pram. I can do it with dad if you don't want to do it. Let's have a look at the car seat. So kind of all these little things where we're kind of programmed to think that could go wrong. I'm the person that will then step in and go like, okay, do you want me to go through that? Maybe I can go through it with dad. Maybe I can go through it with grandma, your best friend. You don't have to be involved in it, but would you like me to go through these things? So kind of putting a postnatal plan in place always, regardless of whether you've had a loss or not, but specifically after loss and pertaining to what they worry about the most.
Yeah. No, I think and it's being add that element of being prepared, isn't it, for as much as you possibly can. And it will never completely take away anxiety, but obviously the more that you have in place, the safe and the more secure and supported as well. So like you say, with other people around you, rather than, like Emma was talking about, everything just being on her, having people around you so that you can share that load makes a lot of difference. And that's very hard to do here because many people don't have family, you know, and we all come from, lots of people come from different countries where we've left our families and our childhood friends, and that can be a challenging thing to navigate. So just finally, because I know we are almost out of time, but if you have one sort of takeaway that you could say to somebody that is currently navigating pregnancy after a loss, what would that be? It's a loaded question. So many things.
One, on advocating for you in appointments, it's very hard to remember everything. So I wrote a letter that said, before you talk to me, read all of this, and it gave all of my history, so that if I was, you know, not with my normal doctor and seeing someone else, I didn't have to go through the emotional labor of explaining everything to try and make myself safe, and they could read it. And then also I then had at the bottom, because of everything I've been through, I will have questions. I do need you to answer them thoroughly, and these are the questions. So I actually wrote the questions on the bottom as well and gave it to them and said, please go through each one with me. And that helped, because otherwise you come out, you think, I haven't asked the questions I wanted to ask, can't remember the answers. And then I would take a print out for them, and I'd take a print out for me, and I'd write their answers down, you know, and I'd take that away with me. And that's how I managed that. And the other one is just a really personal one. As much as you might be terrified of taking photos and videos of yourself during your pregnancy, do it terrified, because whether you make it to term and have a living baby or whether you don't, you will never, ever regret having more photos. My biggest regret with Willow is not having more photos and videos. And my biggest regret with my living child is not having more photos and videos. So no matter the outcome, I promise you'll never regret it. Even if you just put them somewhere and never look at them, but just knowing they're there, I promise you'll never regret having more. That's it.
How about you, Nikki?
My biggest takeaway would be to find your circle. It's not a circle nobody ever wants to be in, ever. We don't want anyone to join it. We don't like directing people to these circles. We wish you never had to be part of it, but they really are out there. They are, especially here. For us, we know there is a lot of support out there, and using those to find the best resources for you that work for your, you know, situation, your financial situation. There is something for everybody, because you need that support consistently. And I know I had a client who found me at 34 weeks. She had found support on a Reddit thread with ladies in like America, Australia. Like, it was wild, but she was like, these women kept me sane. They directed me to think, they really helped each other. So even if it's difficult being an expat, being kind of isolated from your family, and if it is within the realm of possibility for you, to find someone who can support you from day one. Don't assume that is the hospital and the doctors and the midwives, because the training might not be there, but also you will not get the time that you need. And finally, just like give yourself grace, because there is no wrong way or right way to do pregnancy after loss. There is no wrong way or right way to grieve or to process. And it's your own journey. So you have to really, like, between you and your partner, give yourselves grace.
Lovely. No, that's really, really nice sentence. Thank you, ladies. It's been a pleasure speaking to you both, and I hope that many people will find this beneficial. Like we've said a lot throughout this, the last hour, if you do need support, you can contact us through Love Through Loss, and like we say, even if we're not the right person, we can point you in the direction, but you don't have to go through this alone. You don't have to just accept that, I'm going through pregnancy again, I'll just wing it and hope for the best. That's not what we want for anybody navigating this, because it's emotional and it's intense, and you shouldn't feel lost or isolated or alone in this space. So thank you so much for your time, and I'll definitely speak to you both soon.
Thank you very much.
Thank you.